Hi, my name is Claire Song, and today I'll be presenting on COVID-19 and herd immunity. And in this presentation, I'll be comparing Taiwan, a country praised for how they control the virus, with Sweden, a country that has much controversy in how they handled it. So first, a little about myself. I'm currently a rising sophomore attending Dublin High School in Dublin, California. And at my school, I'm enrolled in the biomedical activity. For some clubs, I was the freshman delegate for the club HOSA and a staff writer of Dublin Shield, our school newspaper, and I recently completed MTech's Level 10 Advanced Piano after around playing for 8 years. And I also earned my scuba diving license last year, and I enjoy drawing, and I'm currently volunteering as a TA at my local Korean school, and I act as a book club leader. So I'm sure everyone's familiar with COVID-19, so I'm just going to go over some little background information about it. So COVID-19 originated in Wuhan, China, however is now spread to 213 reported countries. And COVID-19 is a coronavirus, which is basically a family of viruses that can cause different illnesses that range from the common cold to SARS to MERS. The official name of COVID-19 is SARS-CoV-2, or Severe Acute Respiratory Syndrome Coronavirus 2. And COVID-19 has a very high infection rate, so the CDC recommends staying around 6 feet apart when you're meeting others. All right, so what is herd immunity? Herd immunity is achieved when most of a population is immune to a disease, providing protection to the entire population. For example, if 90% of the population is immune to COVID-19, then 9 out of 10 people who meet someone who is infected will not get infected or spread the disease any further. This is what countries are trying to achieve at the moment. In general, this is achieved when around 70 to 90% of the population is immune. However, according to Johns Hopkins, around 70% of the population must be immune to COVID-19 in order for herd immunity to be achieved. There are two ways that herd immunity can be achieved, through vaccines and natural infections. But I'll be talking about natural infection a little later. First, we have vaccines. Until a vaccine is created, people should try to be under strict social distancing as much as possible to try and stop the spread of the disease. Then, when a vaccine is created, herd immunity will protect those who are unable to get the vaccine, such as those with underlying health conditions or newborns. However, people who believe in anti-vaccination or have a religious constraint making them unable to get the vaccine could cause conflict in achieving this. So, how did Taiwan handle the virus? Taiwan has been mentioned as one of the best countries in regards to controlling the virus. As you can see, this is the number of daily new cases in Taiwan taken from Worldometer. COVID peaked at around March, and there have been little to no COVID cases reported from May to the present. Out of 24 million citizens, there have only been 446 confirmed cases and only 7 deaths. To put this into perspective, the US has 1,200 times more COVID deaths than Taiwan. Taiwan has statistically proved that they control the virus very well, so how did they achieve this? In Taiwan, each citizen has a medical ID card, and this ID card has a unique ID number on it. This ID number gives the Ministry of Health real-time data of hospital visits, medical records, etc. When COVID-19 erupted, Taiwan announced that they will be using information from Immigration and Customs, as well as citizens' health card databases to notify their physicians of those with a higher chance of being infected with the disease. All this data allows the government to identify, trace, treat, and isolate cases. They are able to use real-time data to identify where COVID cases were likely to be found and quickly isolate those who have contracted the disease. Taiwan was able to control the virus in a calm, efficient manner, resulting in minimal cases and death. Now, to go back to before, natural infection is also another way to achieve herd immunity. Natural infection is when many people contract, then recover from the disease. This allows people to become immune to the disease by overcoming it, and they won't catch it again. However, there have been reported cases of patients infected with COVID-19 being reinfected, which may cause difficulties in achieving this. Now, you might be questioning this method. Is this truly the best way to handle the pandemic? Sweden believes so, making many controversial headlines. This is the number of daily new cases in Sweden, also taken from Worldometer. The number of cases have been growing consistently, peaking in June. However, there's starting to be a slow decline in the number of cases in the month of July. Out of 10.32 million citizens, there have been 77,281 cases reported and 5,619 deaths reported. These numbers are significantly higher than Taiwan, and it makes you question whether or not Sweden made the correct choice. So Sweden had a very unique approach to the pandemic. The Swedish government simply recommended those who were experiencing symptoms of COVID or those who were over the age of 70 to self-isolate. They also recommended not to have large gatherings over 50 people and simply advised their citizens to keep a safe distance. They closed educational institutions with children ages 15 or older. However, this is about the extent they went for social distancing and isolation. Elementary and middle schools remained open, and restaurants and businesses also remained open. The reaction of the public is inconsistent. Some believe that Sweden's method was not at all a bad one. However, many are also criticizing their approach as well. Many news sources have criticized this method, such as CBS News, calling Sweden an example of how not to handle COVID-19. However, other such sites such as Medical News Today was pleasantly surprised by how there were fewer deaths than expected. To put everything into perspective, I created a chart with 5 different countries: Sweden, the US, Taiwan, the US, UK, and the Philippines. I chose the US as where Johns Hopkins is located, and I chose UK and Philippines as they are geographically similar to Sweden and Taiwan, respectively. As you can see, the US had the highest infection rate of 0.0113%, but their death rate was not as high as the UK, who had the highest death rate of 15.3%. Taiwan had both the lowest infection and death rate. Comparing Sweden to the UK, Sweden had a much higher infection rate, however, a much lower death rate. Comparing Taiwan with the Philippines, Taiwan had a much lower infection and death rate. Some predict that Sweden has a lower infection rate than the US due to the fact that Swedish citizens are all trying to work together in stopping the spread by continuing to wear their masks. However, it is difficult now to determine which method is optimal in the long run. However, with data given now, it is clear Taiwan had one of the best methods in controlling the virus with the lowest infection and death rate. However, one thing that we know for sure is that we can all help slow the spread and flatten the curve by 1, always making sure to wear a mask when you're meeting people outside, and 2, have proper hygiene and make sure to wash your hands properly every time you go outside or every so often in general. Here are the sources I used to create this presentation. So thank you for listening. I want to thank Johns Hopkins for organizing this event. And if you have any questions, you can ask me at csong0208@gmail.com.